Good afternoon. This is Talia MK Healthcare 2.0 Conference, Dubai 2024, and we have with us Mr. Dr. Salman Shahid at NHS Associate Medic, and he's a medical director. First, and he has been awarded as an excellence in healthcare. First of all, congratulations.
Thank you very much.
Thank you for being here. Before I ask you how the directorial work is going on, how does it feel to receive an award like this?
I think it's always privileged to receive these kind of acknowledgements, and awards obviously is always feels good as a human. But I think everything goes down to the team you are working with. So I'm actually proud of my team I'm working, and I think all credit goes to them. That obviously they make that vision and mission happen. What actually what we think in NHS. So yeah, it's always been great, and today it felt great.
So, what is your role as a director, and which health issues are you associated with?
Well, I'm the Associate Medical Director in Manchester Integrated Care Board, and this is where when we talk about integrated care, we're talking about integration of primary, secondary, and community services. Last year, our team won HSD awards for the integration because being considered the best integrated care system, and the role which I have is to look after our clinical and care professional team and to make sure that the clinical governance and effectiveness in the entire system is maintained. So I'm responsible to look after a region in Manchester in terms of the health needs of the population and to ensure that element of this healthcare directorate is being efficiently being delivered in a clinically safe manner.
So, but what other diseases are you prioritize mental health issues?
Yes,
or
yeah,
are
this,
you?
this you're quite right about it. My main portfolio is towards the mental health.
Okay.
We know there is a rising challenge globally of mental health,
Yes.
which was not previously that much acknowledged. But now we know with the destigmatization of the entire process, we know that people are getting more awareness of it. But at the same time, it is bringing more challenge to the policymakers because obviously you can overhaul the system and the number of patients who are attending to see the doctors, we don't have that much of the workforce available to deal with that. And that was one of the topic which we dealt with today in our talk as well, that how to find the solution to these kind of challenges, which is not only happening in England or in West, but at the same time this region and South Asian countries are also facing.
I would like to ask, as people nowadays are being very vocal with the social media and all of these things, everybody as it's like the in topic or the buzzword, everybody would want to have to be related a healthcare issue, mental healthcare issue.
Yeah.
So how do you deal with a patient who is not, God forbid, having such issue, but claiming to have one because he or she heard it online?
Yes.
How do you deal with such?
It's a very, very good question. I think you may not be in the room with us when we said that everyone wants to come under the umbrella of mental health.
Yes.
And this is mainly because the digitalization has helped in one degree where people are able to identify they may have the mental health condition, but sometimes we may over medicalize things when this is not medical. The stress is a driving factor. If you're not stressed, that you will not be paid for your work.
Yes.
You will not get up in the morning.
Yes.
Because that level of stress is okay to go and function. But what we have to do as the doctors, as the clinicians, as a policymaker, is to gauge that what level of stress is become medical and clinically needs to be acknowledged, and what is okay. This is what we call resilience, and how we develop that kind of programs in our schools and colleges and teach our young generation. So when they get into the practical field, they are equipped with the right knowledge and understanding. Well, this is the point where I should be able to manage my condition by myself. And then when it comes to that level, I need to seek for help as well. We did talk about, having these recently Australia or New Zealand, I'm not sure they have done that on the social media. They have put a ban that you can't use it before when you're 16. So it's mainly because of the fact that whatever you see on the social media is not accurate, it's realistic. That's what we call, reality versus perception.
Yes.
So that's very, very different. No one is going to show that, this is what bad is happening to me. They are going to show all the stories that you'll see that this is the best thing in my life and having life of
The
my
best
dreams.
life,
Yeah, so
yes,
that
yes.
is not the truth, and I think that understanding is missing in the community.
How do you think we can work towards early intervention of mental health conditions?
I think the challenge is that first is that we need to have the true understanding that this problem exists. We need to acknowledge that we have to move from secondary care to primary care model. That right when someone is having the problem, the first point of contact for them is they come to their GPs and their primary care clinicians. So the right workforce, right investment, right research, right education needs to be available not only for the patients but for the clinicians as well. What I have figured out working in the primary care system that even our clinicians are not very well acute in finding out and understanding the core background issues and the psychology behind the mental health challenges that we
Yes.
are facing as well. So I think we have to invest and shift our paradigm from secondary care to primary care, and then re-look into the services that whether the investment needs to go from the hospital care into the primary care, and that's only possible when we do the integration, and that's what actually is my role is that how to integrate the services.
That is amazing. Thank you so much for being here.
No,
And
no.
as you're already too educated and you're already telling us how
Yeah.
we should go ahead, how was your this experience has been with us at
I
Healthcare
think it
Point of
was a
Contact?
wonderful experience coming to Dubai. It always feels good. And again, the conference was very well organized as well. And I always believe that when there is excellence, we always look for better as well,
Yes.
which can always improve because this is the way the human exercise. So I'm going to give some constructive feedback as well, and I'm sure I'm going to attend the next one as well.
Hopefully, too, we see you and you'll be awarded again. Hopefully
Let's
soon.
hope
Thank
so.
you so much for your
No,
time.
thank you for your time.
If it's just a buzzword, mental health is a very serious and critical matter. So if you are facing such challenge, please go talk to your adults or a professional, take professional help. And if it's just a friend having it and you want to have it too, please understand this is the seriousness of it. Be safe, be healthy, be kind, avoid using wastage of water and using plastic. And this is Talia MK signing off. Thank you.